This is in response to Amanda's comment. What's the difference between immediate and permanent? So an immediate denture means that the denture is being made and put immediately in your mouth when you get your teeth pulled. So a permanent is a permanent denture. Sometimes immediates become permanent dentures, but a permanent denture is basically when you are already edentulous, meaning all of your teeth are gone and the denture is made from no teeth from those impressions. The way that an immediate becomes a permanent in my practice is, so a patient has teeth, they need pulled, they come into my office, I take impressions of their mouth and I pour up those models, take their bite, pick a tooth color, and I take each of those teeth off of the model and replace them with a false tooth and make that denture to their gums, making an educated guess and judgment where their gums are going to be when they have their teeth pulled. So the denture is then taken to the dentist's office. The dentist pulls the teeth out, the natural teeth, and then places the denture immediately in the mouth. Then the patient comes back to me and we do a post-op check. I look in their mouth, check to make sure that all of their extraction sites look good. Do any adjustments as needed. Sometimes the denture is high in some places and we'll adjust that. Talk to them about education, and then they're on their way for about 7 to 10 days out. In the first 72 hours of an immediate denture, there's a lot of swelling. So the denture is first really tight, then the swelling starts to go down after 72 hours, and the denture gets very loose. At about 7 to 10 days out, I will bring the patient in and do a temporary reline. That's where we put a little bit of material in the denture, take impressions with it, but that material stays in the denture. We just trim the sides, smooth everything out, and that liner stays in the denture temporarily. Again, at 4 to 6 weeks out, the patient's healing is slowing down, but they're still changing dramatically, but slower. Then we do that procedure again. Put the temporary material in there, take the impression, trim it up, they're on their way again. Then I have the patient wait for 6 months from the date of their extractions to get their permanent reline. The reason that I have the patient wait for any more relines is because it is in my experience, especially when I first started my practice so long ago, if you lay too many layers of that temporary material in there, it thickens the denture up every time you place a layer in there. So when you place a layer in there, it opens your bite, opens your bite, opens your bite. So pretty soon your dentures are too tall and you don't have any room for food in your mouth, and it increases the vertical dimension, affecting that temporomandibular joint. I've mentioned this in a lot of my other videos. So you do not want to lay too many layers of that temporary material in there. So one temporary reline at 7 to 10 days out, one temporary reline at 4 to 6 weeks out. Then at 6 months, we take impressions in those dentures and process them with a brand new reline in those dentures. That is the permanent reline. So the immediate becomes a permanent denture. So in patients that have so many changes that are really drastic, we do a new denture at 6 months. Or sometimes a patient gets to that 6-month point and they decide that, you know, I really don't care for the aesthetics of the teeth because the gums are so big when you make the dentures as immediate dentures. They may decide that, you know, I want my teeth a little bit different. I've been looking at them all this time and I want them arranged differently, or I want a different color. Or I look at the denture and the gums and say, there are so many changes that this denture is just not going to work even if I reline it. So we have to make a new denture at that point. So a new denture, we take the impressions, we start from scratch, reestablish that vertical dimension, pick a tooth color, set all of those teeth, and it's much easier for me to do it when we do it like that because your gums have shrunk. They've stabilized, so I have more room to put the teeth. I don't have to shave the teeth so much in order to arrange them because your bones have shrunk, your gums have healed, and now you're stable. So there's a lot more room for me to work in there. I can move the teeth how I want them, shape them how I want them. So back to the question. An immediate denture is one that is placed immediately after you have your teeth pulled. A permanent denture is the one that you're going to wear for a while, usually made from the transition from an immediate or started all over when you have all of your teeth gone. I hope that answers your question. I talked a lot. Take care. Have a good day.